Okay, so for anybody who can't be here, they can always listen to this and hear your questions, because I'm sure if you guys have questions, other people do too. So why don't you guys just do a quick introduction to each other and just say your name, maybe where you're going to do your clinical, and what your master's specialty is, if you're CNS, NP, what type of NP, or healthcare administration leadership. So Amber, I have you first on my screen. Do you want to go ahead? Amber?
Yes.
Okay.
My name's Amber. I am in the healthcare administration and leadership classes, and I'm going to do my clinicals at RUHS Medical Center with the Chief Nursing Officer.
What's RHS?
Oh, Riverside University Health System.
Okay. All right, great. And what's the population there? What's the specialty?
It's a hospital. It's a medical center.
Is there any special unit that you're working in?
No, I was
Okay.
I'm gonna go with the Chief Nursing Officer. So.
Perfect. Because that's what you're going to be someday, right? Okay, Lisa.
Yep.
Okay, hi. So my name's Lisa. I'm in the FNP program at Azusa, and let's see. I really am interested in women's health and pediatrics. So since I'm already doing my women's health rotation this semester, I was wondering if I could do clinicals at the same place where I'm doing my rotation. Is that possible?
Well, we'll talk about that. Get into that. I'm sure other people have questions about that. So.
Okay, so that's where my question is. And when I was trying to figure out clinicals, I had emailed Stephanie. As I think you're aware of that, Jill. Yeah.
Yep.
Just trying to find a place to go because I know placement's difficult. But I was thinking either that or doing pediatrics, which I love, and I just did it last semester.
Great.
So that's
good.
Yeah.
Okay. Super. And then Erica?
So my name is Erica, and I'm working for Kaiser Urgent Care right now, and I'm in the Healthcare Administration and Leadership program. The preceptor that I'm going to follow, she's a department administration manager, and she covered, I believe, 4 departments. She covered OBGYN, pediatric, internal family medicine, and also nursing clinic at the Pasadena Kaiser building.
And what's her title again?
She's like we call DA, Department Administration, and then under her she has assistant DA.
Great.
She oversees those 4 departments.
Great. That should work out perfect for this class.
Yes.
Great. Okay, and Janelle, let's see how your phone's working.
Hi, my name is Janelle. I'm actually in the family nurse practitioner program. I don't have placement yet. I've been emailing back and forth with Stephanie, and she's working hard. I think she has one place in mind, but she doesn't have set details. She'll get back to me hopefully by tomorrow.
Great. Okay. And Sarah?
Hey everybody, my name is Sarah and I am one of the House students, Healthcare Administration and Leadership. And it's nice to see you guys. A couple of you, we've been in classes together now for almost like a year and a half, and I missed you guys during the management courses. But I work at Sharp Chula Vista. I'm going to be doing my clinical at Sharp Chula Vista. My preceptor is the acute care director, and I'll be looking at congestive heart failure patients and how to help with the reduction in readmission.
Great. Okay. B, you just joined us. You want to say a quick hello and what program you're in? I wonder if she's on the phone. I see a little phone thing there. B, you can unmute yourself if you go to the left bottom corner of your screen. Well, if you figure it out, just give us a shout out and say hello. So I'm glad to have so many of you here today. I thought what I would do today is share my screen, and well, first of all, we will go over, oh, hearing somebody there. I'm going to share the syllabus. So can you guys see the syllabus?
Hello.
Yeah.
Yeah.
Okay. Hi, Anna.
Hi. Sorry, I couldn't figure out this thing. Now I did.
Now you're here. You want to just say a quick hello and what program you're in and where you might be doing your clinical portion of the course?
Well, my name is Anna Buchting. I'm the CNS program right now, and with the clinical settings, I don't know yet. We are working on that with Stephanie.
All right, great. And then Elizabeth, I saw you just joined. Do you want to say hello?
Hi, I'm Elizabeth Lopez. I also have been in the Hall program as well. I am currently working at Kaiser NICU. I will be doing my clinicals with a nursing director at Children's Hospital Los Angeles, where I previously worked. She's clinical and professional development for the whole hospital, but she also works with different entities and stuff like that. So for anything chronic and things, I'll probably be down in the NICU again working with them as well.
Great. And B, can you speak?
Yes, can you hear me?
Yeah. Welcome. Want to say a little bit about yourself?
Yeah, so my name is pronounced Bea. I'm in the FNP track. My clinical placement is in an FQHC site in Colton. It's a family medicine clinic and sees patients from 0 to 100 years old, pretty much.
That's a broad range.
Yes.
All right. So why don't we just start off by looking through the syllabus for this course. Can you all see the syllabus Word doc that I have pulled up?
Yes.
Just give a thumbs up if you're muted. Okay. So this syllabus is located in the Canvas course, and I think you have all gotten into the Canvas course there. And a lot of you, I think, had some questions about this course, more, not so much about the didactic part, but about the clinical. It's called clinical when you're a nurse practitioner in CNS. When you're a healthcare administrator, if you guys wouldn't mind just muting yourselves, I think I'm hearing a little bit of feedback. So if you can go to the bottom left-hand corner of your screen and mute yourself or your telephones, that would be great. This course is 4 units for HAL students and nurse practitioner students, and it's 6 units for clinical nurse specialists. So that's for Anna. There's 2 units of theory or didactic and 2 units of clinical, 2/4 units of clinical, that should be, for CNS students. So what we do during the theory or didactic part will be our 2 units, and each unit is equal to 45 hours. So we should, if we break that down, we should do about, for clinical hours, it would be 90 clinical hours for NPs and HAL students, and it's 135 for you, Anna. But we're all going to do the same amount of in-classroom didactic units. So we'll be doing everything. Everybody will be doing all the same thing as far as the didactic Canvas classroom component. the difference will really be the HAL students are assigned to me as their clinical practicum faculty, while the NP and the CNS will have Denise Chapin. So Denise is a seasoned clinical faculty, and the reason for that is because NP and CNS have to do direct care in their clinicals, and healthcare administration and leadership are looking more at the systems for how we manage patients. So we should all have a clinical or a practicum in a setting where we're looking at where we can meet the objectives of this class. So really the objectives are to look at complex patient populations and how they are managed over care transitions. So I immediately think of chronic disease as something that's complex, and but it can also be something like you're thinking about Lisa and women's health care or pediatrics. Think if you have a child with say cystic fibrosis, you know, that's a complex patient who sees multiple providers, takes multiple medications, and is at risk for you know, lots of maybe polypharmacy, redundant care, divergent physician advice there. So I think anywhere where we can look at a patient population that's complex and see how we as practitioners, as administrators, can go in there and better manage care for these complex patients is where you should be doing your practicum or clinical. So that being said, I think everybody has a pretty good clinical setting already. Anna and Janelle, I think you guys can work with Stephanie to find something, and then Lisa, I think if you can make the argument that you can meet the objectives of this class in a women's healthcare setting, that's fine. You can't double dip. If you're taking another practicum or clinical and this one, your hours have to be completely separate. So why don't we just go through a little bit about the expectations for the course, and we'll go through the syllabus, and you guys, you want to raise your hand and shout out if you have a question, that's fine. This is the reason we're meeting tonight is for you guys. So let me know when you have questions. Anything right away that any burning question? All right, so what I have done here is in this syllabus is put where the MP and CNS will be meeting. So you guys will be meeting every Monday, and that's going to be in Building 1 on the West Campus of Azusa in room 332 with Denise Chapin. And her information is right there on the second page of the syllabus. You will also be getting, doing all your documentations, your post-clinical conferences with her. She will be the one who looks at your SOAP notes, your Metatracks, and all of that kind of thing. That's not my expertise. I can try to answer questions about that end of it, but really Denise would be the one to know better about what your expectations exactly are going to be in your clinical. I do know that the hours for this class, the 180 for Anna as a CNS and the 90 for the MPs, those have to be direct patient care where you're seeing patients on a daily basis, assessing them, diagnosis, SOAP notes, those kind of things. For people in the HAL program, so I think we have 5 in the HAL program, 4 NPs and 1 CNS. What you're going to be doing is going into your practicum setting with more of a broad overview, and you're going to be looking at systems and how we care for people in the healthcare systems, interdisciplinary care, how all of that care takes place. And we will be meeting every other Monday using Zoom. And I sent you out a invitation today, so a Google invitation. If you accept that, it should go right into your calendar. But this link that you clicked on today, this Zoom link, that is my permanent link. So whenever I say let's meet with Zoom at this time, you can just go to that link there. That's will always take you to my own Zoom link page. So I'm going to have virtual office hours Monday between, it says 5 and 6 here, but it's 5 and 7, and Thursdays from 4 to 6 p.m. So you download this syllabus and you click on this here, and you let me know if you can see this. I might have to share a different screen. Hold on a sec. So if you click on that, it will take you to my calendar. And then you just go in and you click on whatever, here, this is Thursday, it's saying this is 7 to 9. You can sign up for a 30-minute increment office hour just by clicking on that. It'll tell me who you are. You put save in there, and then I'll see that this person has signed up for a virtual office hour with me. If you want a whole hour, you go ahead and take 2 of those spots. So those are the hours that I'm going to have available for you, but I can meet you at any other time if you have any questions. So go ahead and you can use my cell phone. You can text me. I'm only 1 hour time difference this semester. Last semester I was 3 hours different. So go ahead and feel free to text me. I prefer an email first, then a text, and then a phone call. So that's
I gotta go. It's Elizabeth. I gotta go to work. So thank you.
Okay, bye, Elizabeth. So really the focus of this course is, if we go down, we look at the objectives here, we're gonna describe models of care management and how they're used. We're gonna look at roles and responsibilities in managing patient care as part of multidisciplinary teams. We're gonna look at the literature with respect to selected clinical improvement projects and national guidelines and standards of care.
So I'm sorry. Are you back on the, I don't see that Word document again.
Oh, that's
All
right.
I see is this.
Thanks for letting me know. I have to share my main screen. Okay, I'll share. All right, so now you see the schedule, right?
Right now is the schedule, yeah, but not the syllabus. It's just the schedule. There we go.
Okay. All right.
Yeah.
So when I share my screen, I can pick individual things to share or my main screen. So hopefully now I'm sharing my main screen. You should be able to see that. Thanks for letting me know. We're gonna look at the literature, and so you're gonna say, okay, I picking on Lisa because I'm thinking her in women's health and maybe cystic fibrosis. Going to look at what are the national guidelines for cystic fibrosis, and what are the standards of care with regards to taking care of this complex patient population.
Okay.
We're going to do an evaluation or an assessment of how complex patients are managed in your healthcare setting. And you're going to come up with some kind of idea on how this care might be improved. And then you're going to walk out the details of how you might improve this by using a logic model, which is kind of a conceptual map of how you will improve this. So those are the 2 big assignments, really, the assessment and the logic model. And I'll show you the breakdown of that in a sec. There's no textbooks for this course. I think nowadays there's so many journal articles out there that we can usually find journal articles available for free. So these are some resources here that are for evidence-based practice and how to do lit reviews, and those are all free, and they'll be referenced throughout the course. There's the online discussions that you'll be involved in each week, and I think everybody's already gone in and done the discussion. So the discussions are 4 points each, totaling a 20% of your whole didactic theory grade. I just want to point out, in your initial posting, you should have 2 references, and in your reply, you should have 1 reference that you haven't already referenced in the original posting, for your initial posting. You should use APA format in your discussion postings. There's learning activities. We have a group project, and that's week 2 and 3 is a group project. Unit 6, you just have to submit your idea for your care management assessment topic. So that was that assessment in the logic model I was talking about. 11 is the outcome statement, and that's part of the logic model, is your outcome statement, and then an evaluation plan worksheet. So each of these weeks will fully describe these more, but I just want to let you know those are the 4 learning activities. The 2 major assignments are the SWOT analysis and the logic model overview. Okay, so the SWOT analysis, SWOT stands for strength, weakness, opportunities, and threat. So you'll look at your healthcare setting where you're doing your clinical in, and you'll say, what are the strengths of how they're currently managing care? What are the weaknesses? What are the opportunities? And what are some of the threats? And then, like I said, the opportunity, you will take one of those ideas you have for an opportunity and operationalize that in your logic model. But this SWOT analysis is 30% of your total grade, and the logic model is 40%. So those 2 assignments alone are 70% of your total grade. 20% is your discussion posting, and the other 10% are those these learning activities here. Does that make sense?
I have a question.
Yeah, go ahead.
Is there a certain way that you want us to write the SWOT analysis? Is it just a Word document, or you want it like in the presentation, or?
Yeah, there are complete instructions. So it says here instructions and a rubric. So of course, each one of these, this is just a really, overarching view of everything. There's going to be really detailed instructions for each one of these things that we're going to go over in the weeks preceding when they're due. But if you want to know that right now, you can go ahead and download the syllabus and look at the instructions and rubrics available there. So this is, everything coming at you at once. I'm sure it's really overwhelming, but I want you to know that what's in the syllabus here, and then, as we're going through things week by week, everything is going to be broken down for you, and we'll go into those in more depth. So in the clinicals, there's, at the end of this syllabus, there's expectations or requirements for PAL students, CNS, and the NP students. In this part, it gives you the breakdown, like we just talked about, of all the assignments and your grade. What I really want to emphasize here is you have to pass both components of this course in order to pass. So if you fail the didactic part or the classroom part and you pass the clinical part, you still can't pass the class, and vice versa. So you pass the clinical but not the theory or classroom part, you can't pass the class. So the classroom part that we're going to do on Canvas, that's all grades and breaks down to a grade of 100%. The clinical or practicum, that's just a pass or fail. But you have to pass it in order to pass the whole class. Is that clear? As all classes in the master's department, B- is passing, a C+ isn't, so you have to get a B-. Policies here about online attendance, APA format, and there's guidelines for APA format there. And more things about practicum expectations, but here's the breakdown for your whatever your role is. So for clinical nurse specialist, it goes in and says you have 180 hours here, and please do read this part on your own for your specialty, but it gives you the breakdown of how you will be graded for your practicum or your clinical. So there's a pass or fail for your professional behavior, pass or fail for your SOAP notes, pass or fail for the clinical performance, and pass or fail for your practicum goals and your learning plan. For the HAL program, it's pretty much the same, except for you're not going to do SOAP notes or MetaTrack. You're going to have a log that you turn into me weekly. So you have professional behavior, the documentation of your learning experience, your practicum performance, and your logs. And then the nurse practitioner, I think all of you as nurse practitioners have already had a clinical class. That was a prerequisite for taking this class. So these guidelines are the same for no matter what your clinical or your practicum class is. So this is something you've probably already seen with your pass or fail for professional behavior, your SOAP notes, your preceptor evaluation, and then your OSCE. You'll have an OSCE for that. So please do read through this. I think that's all I have on the syllabus there. Any questions on that?
No.
Okay. I'll go into the course. Any questions on the Canvas site?
You know, did anybody else have a hard time? I wasn't able to get into any of this until Monday. Was anybody else? Because for both classes, you know, this one and the women's health class, I wasn't able to get anything. I kept checking on Canvas all week, or for the last few weeks, and I didn't get anything until Monday, till the day that the semester started. So I don't know if it's just because they're still getting used to Canvas or what, but anybody else have a hard time?
Yeah, I couldn't get into until Monday also.
Me too.
Yeah.
Yeah, because I published it mid-December, so
mid-December about collaboration something, but every time I try to click on something, it leads to nothing. So I wasn't sure what that was.
And it was the same thing in my women's health class. Nobody could get into their syllabus until Monday either. Same thing. So it must be a Canvas glitch.
For stuff like that, we have IMT technical support, but basically you just it's ITT support at apu.edu. So that's really the go-to if you're having technical issues with Canvas. I can help troubleshoot a lot, but they're really the go-to people if you're having issues with that.
Okay.
So some of you haven't taken online classes before, right?
Yeah, this is my first.
So hopefully, I've tried to set this up so each class is the same. So you'll go in, you'll see that there's, it's HQ time. You'll go into each of the modules. Should we all do trivia together? We might win. So we go in, so week 0 here has all your resources for doing a Google slide presentation, how to get Canvas help, using a Google Doc, technology requirements, clinical practicum resources, library and writing. So all of those resources are in there for you. For the HAL program, this is where you're going to go to get a lot of your forms, your preceptor agreement form, learning contract, your logs, which some of you have already downloaded and shared with me. For the NP and CNS students, you don't have to do a log. You can if you want to keep track of your time, but that's what MetaTracks is for, so you'll keep track of your clinical time in that. And then at the end, we all have to do these preceptor evaluation, the student evaluation of the preceptor and student evaluation of the clinical site. I also have the handbooks in here for the HAL and the NED program. NED is nursing education, and the APRN, which is the CNS and the MP. So resources are there for you. And the modules should all be set up pretty much the same, where you're going to have a course introduction, your readings, multimedia, the discussion, and if there's any assignment. And then some reminders. So I think that's it. I don't want to overwhelm you any more than I probably already have. Can you guys think of any questions?
I was just going to ask. Go ahead.
Just for the NP one, I don't know if you know the answer. Maybe Denise will. You know how many SOAP notes does she want us to make or write?
I'm not sure. We talked about that. I got on the phone with her yesterday, but she was going to find out. She thought maybe 8, but good question for her.
Okay. I was just going to ask if we could all have each other's emails so that we could, you know, be able to communicate with each other if we had a question. Just it's in a roster somewhere.
Yeah. So if you go into here under people.
Okay.
You'll see a list of all the people, and so here's the group with everybody, and then the HAL students are here.
Okay.
This group. So this is kind of new for me too, so I've been playing around with it. I think there's a couple new technologies that I'm going to have try out this semester, and hopefully it'll be fun. But really I hope, if you guys could use Google Chrome for Canvas and any of the extensions that are needed for this class, I think that would, I think Canvas works better on Chrome. I'm going to try a few fun things. So if they turn out not to be fun and you have no idea like what I'm talking about or what's going on, then always let me know. But there's something I've been playing around with. It's called Insert Learning. And so you would just go ahead and download Insert Learning, and then I'll be able to share websites with you and put notes on them. So I'm hoping that will work, and I'll give you some instructions on how to use that.
Okay. Yeah. What happened?
I don't know.
That was weird.
Hey, Jill, for the health students, I don't see my name on it.
On the list?
Yeah.
Who's that, Erica?
Yeah.
That's because I moved you over to the HAL student list.
Oh, okay, I see.
Right, there you are.
Thanks.
So that's, I was around with, I think I sent all of the HAL students an announcement separate than the other students, and Chanel told me she did get it. I don't know if the rest of you did or not.
Okay.
But as far as
for those of us who are in, like Janelle and Bea and myself, the rest of us who are in the NP and the CNS, does that mean we're meeting with Denise every Monday, or once, you know, is it only going to be once a month, or what?
No, it's every Monday. And
Every Monday. Okay.
The first Monday will be the 28th, that she'll be meeting with you at room 322. And if there's any change to that, she'll go over that with you. But I think it is every Monday.
Okay. Okay.
I think that's it.
Excuse me, for the CNS, you might don't know the answer, but is 180 hours clinic or is 135? Because this looks clear to me, but if you know.
I think that works out to a couple shifts a week, right? 180 hours over 15 weeks.
Yeah, this is 135. I thought it was 185, but 135, but I think you mentioned 180, so I'm not sure.
Who has a calculator? 45 times 4. I think that's,
wow,
180.
Yeah, it's 180.
All right, thank you.
Okay. I guess regarding my clinical placement, I should just email Stephanie again and see if she can come up with something that is more family, you know, well-rounded, I guess. I don't know. I mean, because when I emailed her before, she said, you know, I'm focused more on the women's health ones right now, and I'm more concerned about that. See if you can use your own resources. So that's why, you know, I don't know a lot of primary care doctors. So, because I'm a SICU nurse, you know, so everything I do is in the hospital, and it's all, you know, ICU, cardiac ICU, that sort of thing. So.
Yeah, it doesn't mean you can't do your practicum or clinical there. You'll just have to see how maybe interdisciplinary, you know, teams are working with to place or refer people afterwards.
I mean, we do that all the time.
Yeah.
But I guess, who would be my preceptor then?
It can't. Yeah, you can't have your boss be your preceptor.
Right. Right.
But
so would it be a surgeon?
A what?
A surgeon, perhaps, or
no, not a surgeon. You know, surgeons, they have such narrow minds. All they're going to be thinking about is surgery. You want to be thinking broadly. Like, do you have
right.
care managers or?
Yeah, I could maybe talk with maybe one of the case managers, maybe.
Yeah.
But otherwise, I mean,
somebody with the masters.
Yeah, that's a problem. But I would rather it be primary care anyway, you know, since that's what I'm going to be doing eventually.
Yep.
So, but I'll email Stephanie. If not, then, you know, I don't know. I don't know.
I think Stephanie would appreciate it if you could put forth some names if you have an idea. You know, maybe you could ask while you're at work and then give the name.
And go from there. Yeah. Okay.
Jill, if it helps, I work in a primary care setting. So if she needs places, I might be able to help. We have 11 sites in Riverside County. So
God bless you. Where are you? You're in Riverside. Which primary care?
I'm at Riverside Neighborhood Health Center. So I'm at one of the 11 county clinics.
Okay. Because I live in Redondo, So I was just trying to figure out, like,
That's far.
is it, I know. I know.
Yeah.
I had to, my first semester, I drove to San Dimas. That was, yeah, that was a drive.
I also might know some people working in primary care in LA County. So let me I can email someone. And see
God
if-
bless you. Mwah. Thank you.
And then, Lisa, Amber's, I think your name under people is Amber.
Is it Castle with a K?
Yeah. I think your email is A Kessel 09. Yeah.
Yeah.
Okay.
Is your married name?
Okay.
Yeah, my
Drainville?
married name is actually Drainville.
Okay.
Castle is my maiden name.
Okay. Okay. Hi, Amber. Nice to
Hi.
meet you.
So I'll let you guys connect. Thanks so much.
No problem.
Yeah, this is great. Thank you. This is cool. Never done this before.
Just like being there.
Yeah, well, I'm 50 and I'm finally doing it. So there you go. All right.
Good for you.
All right. Right on.
Okay, I think that's it. Please email if any other questions. Okay, well, good. Thanks so much for there's Sarah's puppy. Thanks so much for joining.
She had to get in the picture.
Thank you.
Thanks.
Where's Doug? Doug,
Can't help himself.
come here,
I
Doug.
know. Yeah, he's fine.
I'm trying to get my dog, but he's too lazy. Yeah.
I know. They all have to be a part of it.
No, he has no interest. Come on. Yeah.
What do you have?
This is a Santa Monica rescue pug.
Oh, from Santa Monica? Okay. This is my fat lab.
He's a bug, a Boston Terrier pug mix. You're tired, huh?
That's what I thought. Yeah. Boston Terrier and pug. Huh?
Yeah.
Okay.
He's not very enthused.
That's
Yeah, this
that's
one.
kind of surprising for a pug, though. They like to snuggle. I have a Chug who is Chihuahua and
Chug?
pug. Yeah, and he loves snuggling.
Oh yeah, this guy can snuggle all day.
Yeah.
Snuggle and
We got a
eat.
Chihuahua. Is a
What's
Chug a
that?
Chihuahua and a?
Yeah.
Is it
He's
Chihuahua? Okay.
Chihuahua and pug. Yeah.
That's cute. That's cute. All right, right on. Well, thank you, Amber. If you have any connections, let me know. Just drop me an email.
Yeah, I'll send out some Facebook messages. It's the way everybody communicates, I think. And I'll let you know what I find.
Okay, awesome. Thanks so much. I appreciate it.
No problem.
Okay, cool. Bye, guys. Have a good one.
Good night, everyone.
Bye.
Good night. Bye. Okay. All right. All right.